Hi, everyone. My name is Nora Bennani. I am a faculty within the Division of Hematology with the Lymphoma group. It is my pleasure today to talk to you about a new diagnosis of T-cell lymphomas. And the way I will structure this is basically how I talk through a new diagnosis with one of my patients when I see them in the clinic. So what is a lymphoma to begin with? Often there is a lot of confusion on what it means. A lymphoma is a blood cancer. It involves some of our white blood cells. We do have a variety of white blood cells. In this case, the lymphocytes are the cells, the white blood cells or the immune cells that are affected. So there are two types of lymphocytes, and they are the T lymphocytes, T as in Tom, and B lymphocytes, B as in boy. In the case of the T-cell lymphomas, the T lymphocytes are the ones that are abnormally growing and forming tumors. In our throughout our body, there is the lymphatic systems that goes along our vasculature. There are lymph nodes that are scattered throughout our body. And you know that these lymph nodes can enlarge at times when there is an infection because your immune system is doing its job to try to protect you from the infection. These lymphomas often will affect the lymphatic system or the lymph nodes. So most of the time when the case comes in, when a patient comes in, it is because they've noticed an enlarged lymph nodes. However, not all lymphomas affect just the lymph nodes. You may see enlargement of, an organ being affected, like a kidney, stomach, even brain sometimes. Now, let's go back and talk about T-cell lymphomas. So, and I always start this discussion by telling my patients that there are actually about 130 types of lymphomas. It's not just one disease. And that often triggers a lot of, wow, 130 lymphomas. Yes, it is 130 lymphomas, and the number is growing as the technology evolves. So we divide these lymphomas into two huge categories. There are the Hodgkin lymphomas that you may have heard of that affect the youngsters, and it is typically highly curable. But there are also the non-Hodgkin lymphomas. Anything that is not a Hodgkin lymphoma, there are 5 subtypes. Anything that is not a Hodgkin lymphoma is called non-Hodgkin lymphoma. And that's, nothing fancy about that. And based on the type of the lymphocyte that is affected, these non-Hodgkin lymphomas are divided in B-cell non-Hodgkin lymphomas and T-cell non-Hodgkin lymphomas. So now we're going to talk purely about the T-cell non-Hodgkin lymphomas, okay? And there are about 30 subtypes of the T-cell non-Hodgkin lymphomas. They are relatively rare. If we were to talk about the non-Hodgkin lymphoma incidence in men and women, it's about 4% of all the type of cancers that affect humans. So it's relatively rare. T-cell lymphomas, I usually quote a number of about 3,500 to 7,000 cases, new cases in the Western world. In Asia, that number can be a bit higher because there is a higher incidence of EBV, which is the monovirus. Okay, the way I look at this T-cell lymphomas and the way I think about it, and I like to explain that to my patients, this T-cell lymphomas can involve the lymph nodes, and that's what we call a nodal node T-cell lymphoma. It can involve organs outside of the node, and that's what we call extranodal, so outside the node. And it can be anywhere, can involve the skin, it can involve the gut, and there are the leukemia forms as well. So where the lymphoma actually presents as circulating malignant cells in the peripheral blood. So this is how I look at it: nodal, extranodal, and leukemia forms. Okay, now I will skip to how it does present, how one recognizes that they have a lymphoma. These lymphomas often, as I mentioned, will present because the patient suddenly is feeling sick, or over few months they have noticed a few changes in their health. Oftentimes, this is a disease of older patients, but there are incidences or some subtypes that tend to affect more the younger patients, like the gamma delta T-cell lymphomas. They tend to affect more the younger patients. There is a higher frequency of occurrence in men, so it's a 2-to-1 incidence. And most of the time, the patients will notice some changes that we call the B symptoms. What are these B symptoms? And you're going to hear about this, and you're going to be asked these questions. Do you have fever that cannot be explained because of an infection? Have you noticed weight loss, significant weight loss, without even trying? We all know that it's difficult to lose weight. And when it becomes so easy to lose weight, that's not a normal thing. Some patients will present with decrease in energy, so they are just so fatigued. And some may have what we call night sweats. And when we mention night sweats, we are talking about drenching night sweats. This is when the patient have actually to wake up in the middle of the night to change clothes and even change sheets, because that's how drenching it is. Okay, so those are the B symptoms, and it's not uncommon for patients with new diagnosis of T-cell lymphoma to come in with some of the symptoms.
I want to express our sincere thank you to our patients, to the members of our Mayo Clinic Lymphoma Disease-Oriented Group, to the Mayo Clinic, and to the Goldman Philanthropic Partnerships for this generous gift to produce this series. This gift has an incredible duality in that it goes directly toward enhancing patient care and provider education. We are at a time of phenomenal rapid change in the treatment plans, the biology, and approaches to clinical care in patients with lymphoproliferative disorders. This project will serve to inform. Again, our sincere thank you, and in the words of Dr. William Mayo, quote, "The needs of the patient come first."